And I saw Anthony Fauci the other day. Somebody said to him, "What are you personally doing to protect yourself against COVID?" Because he's in an older age cohort, so he's in one of the vulnerable age cohorts. And he said, "Well, I take a lot of vitamin D3." And that's well known. It's well documented. About 95% of the people who have died from COVID are vitamin D deficient. So we know that there's a link between vitamin D deficiencies and COVID. Well, we also know that every Black American is vitamin D deficient because the vitamin D is made in the melanin in the skin, that interaction with sunlight does not take place in darker skin colors. And so the vitamin D is not being manufactured, and Black Americans need to take vitamin D supplements. Well, how come we haven't heard that from Tony Fauci? Tony Fauci is taking vitamin D for himself. He knows that African Americans are more likely to die from this disease, that 24% of the deaths are African Americans. He knows that if African Americans are vitamin D deficient, why isn't he saying to them, at least until we get a vaccine that works, until we get some antivirals that work, why don't you take care of your immune systems? Why don't you reduce the amount of sugar that you're eating? Why don't you increase vitamin D? Why don't you try to spend as much time out in the sunlight and fresh air as you can, and exercise and take care of your bodies? And that's what we really want our public officials to be telling us. Tony Fauci took over that agency in 1984. And at that point in history, 12% of Americans had allergic and autoimmune diseases, chronic diseases. Today, 54% of Americans do. That's under his watch. His job at NIAID, at the National Institute for Infectious and Allergic Diseases, is to protect Americans from autoimmune diseases and allergic diseases. He's been a total failure at that. And, part of the reason is the only solutions that he has are patented pharmaceutical drugs. And what we really should have in our country are health officials who are telling us how to eat, who are making sure that the big, food industry, the big pesticide manufacturers are not poisoning our food. Our food is healthy, and that we know how to eat healthy food to protect our immune systems, to build our immune systems, to make them robust. And, those are the things that you really wish that our health officials would be telling us, but that unfortunately most Americans don't have that knowledge. And particularly, you get into urban African American communities where, the level of diabetes and obesity and all of these other comorbidities is off the charts. And people are eating. You see people on the street eating potato chips and and sugar drinks and all of these kind of things. And and yet they're wearing masks and they're hiding indoors all day. And you want to say to them, if you really want to protect yourself, it's not so much about the masks and it's not so much about locking up. It's making sure that you eat healthy and that you live healthy lives. And I just wish that our regulatory officials were educating Americans about that stuff, but they're doing, unfortunately, the opposite.
Yeah, and in some ways you're dealing with an erosion of trust, right? So in order for this, the medical institution to be trusted, they need to show themselves to be trustworthy, and if they can't do it, then I think it's important. The onus falls on the people to do it, to inform one another and to support one another in their journey. I actually recall a moment in time, when we really started thinking about our health seriously. I came home and I was like drinking a bunch of Gatorade, and my wife was just like looking on the label and saying, like, you're consuming all these things, and she's breaking down all the ingredients and saying, like, you are a professional athlete. Like, the demands on your body are extremely high. And you're in an extremely intense, strenuous profession. And look what you're drinking. Look what you're consuming. those are the good things a wife can do for you. Is to be extremely honest and real with you. But this is we're talking about a certain level of accountability that even in the NFL, which is the highest form of performance, like we still are pushing ourselves to get the most out of our bodies and to really understand what we're putting inside of it. So again, like we're proud of this work that we're doing. We're proud of it. We're really trying to push a needle forward. And there's just so many things to battle that we got to battle here. But I think even for all your followers here, this is a fight. And we need to be able to arm ourselves for the fight here.